Did you know that over 537 million adults worldwide are living with diabetes, and nearly half of them don't even know they have it? What's even more alarming is that the early warning signs are often dismissed as just being tired, stressed, or getting older. Hi everyone, I'm your name, and in today's video, we're going to talk about the early signs of diabetes that you should never ignore. Whether you're worried about yourself or a loved one, this information could literally save a life. So make sure you stick around until the end, where I'll share crucial information about when you need to see a doctor immediately. Before we dive in, please hit that like button and subscribe for more health content that could change your life. And don't forget to turn on notifications so you never miss an update. Let's get started. Before we jump into the warning signs, let's quickly understand what diabetes actually is, because knowing this will help you understand why these symptoms occur. Diabetes is a condition where your body either does produce enough insulin or use it effectively. Think of insulin as a key that unlocks your cells, so glucose, or sugar, from your food can get inside and provide energy. When this system breaks down, sugar builds up in your bloodstream instead of fueling your cells. There are two main types we'll focus on today. Type 1 diabetes develops when your immune system attacks the insulin-producing cells in your pancreas. This usually appears in childhood or young adulthood, though it can happen at any age. Type 2 diabetes is far more common, accounting for about 90% of all diabetes cases. It develops when your body becomes resistant to insulin or your pancreas can't keep up with demand. This type typically develops in adults, but we're seeing it more and more in younger people due to lifestyle factors. Now, here's why early detection matters so much. When caught early, type 2 diabetes can often be reversed or managed through lifestyle changes. Even type 1 can be managed effectively to prevent complications. But left untreated, diabetes can lead to heart disease, kidney failure, blindness, and nerve damage. So let's talk about those early warning signs your body is sending you. I'm going to walk you through 10 early signs of diabetes. Some might surprise you, and you might even recognize yourself in a few of these. Don't panic if you do, just pay attention and take action. Sign number 1. Excessive thirst and frequent urination. This is often the first sign people notice, and these two symptoms go hand in hand. When you have too much sugar in your blood, your kidneys work overtime trying to filter it out. This extra sugar pulls water from your tissues, leaving you dehydrated and constantly thirsty. You might find yourself drinking glass after glass of water and still feeling parched. And naturally, all that liquid has to go somewhere, so you're running to the bathroom every hour, including multiple times during the night. Now, we all have days where we drink more water and use the bathroom more often. But if this pattern continues for weeks, it's time to pay attention. Are you waking up 2, 3 or more times every night to urinate? That's not normal, and it's worth investigating. Sign number 2. Unexplained weight loss. Losing weight without trying might sound like a dream come true, but when it comes to diabetes, it's actually a red flag. Here's what's happening. Your cells are getting the glucose they need for energy because insulin is working properly. So your body starts breaking down muscle and fat for fuel instead. You might be eating normally, or even more than usual, but the pounds keep dropping off. This is especially common with type 1 diabetes and can happen quite rapidly. We're talking 10 to 20 pounds in just a couple of months. If you're losing weight and you haven't changed your diet or exercise routine, don't celebrate just yet. Get it checked out. Sign number 3. Increased hunger. Despite eating regular meals, you might find yourself constantly hungry. This symptom is called polyphagia, and it's closely related to that weight loss we just talked about. Your cells are literally starving because they can't access the glucose in your bloodstream. So your body sends hunger signals trying to get more fuel. It's like having a car with a full tank but a broken fuel line. The gas is there, but it can't reach the engine. You might notice you're snacking more often, eating larger portions, or thinking about food constantly. And here's the frustrating part. No matter how much you eat, you still feel hungry because your cells still aren't getting fed properly. Sign number 4. Persistent fatigue. We all get tired, but diabetes fatigue is different. It's a deep, overwhelming exhaustion that doesn't go away with rest. Remember, your cells aren't getting the energy they need from glucose. Plus, the constant urination disrupts your sleep, and dehydration makes everything worse. You might feel like you're dragging yourself through the day, struggling to concentrate, or needing naps that never seem to help. Many people dismiss this as stress, getting older, or just being busy. And yes, those can cause fatigue too. But if you're experiencing this alongside other symptoms on this list, diabetes could be the underlying cause. Don't ignore persistent exhaustion. Your body is trying to tell you something. Sign number 5. Blurred vision. High blood sugar levels can cause the lens of your eye to swell, changing your ability to focus. You might notice things look fuzzy, you're having trouble reading, or you need to squint more often. Here's what's important to understand. This isn't permanent damage yet. If you catch it early and get your blood sugar under control, your vision typically returns to normal. But if diabetes goes untreated for years, it can lead to serious eye problems, including diabetic retinopathy, which can cause permanent vision loss. So if your vision seems off and you can't blame it on needing new glasses, especially if you have other symptoms from this list, it's time to get your blood sugar checked. Don't wait until you can't see at all. By then, the damage may be much harder to reverse. Sign number 6, slow healing cuts and bruises. Have you noticed that small cuts, scrapes, or bruises that used to heal in a few days now stick around for weeks? This is a major warning sign. High blood sugar affects your circulation and damages blood vessels, which means your body can't deliver nutrients and oxygen to wounds efficiently. It also impairs your immune system, making it harder to fight off infections. Pay particular attention to your feet. Diabetes can cause nerve damage that reduces sensation, so you might not even notice a small cut. Combined with poor healing, this can lead to serious infections. If you're finding unexplained bruises, cuts that won't heal, or any sores on your feet, don't brush it off. This is your body waving a red flag. Sign number 7, tingling, numbness, or pain in your hands and feet. This symptom is called peripheral neuropathy, and it's one of the most common complications of diabetes. High blood sugar damages nerves, especially in your extremities. You might experience tingling sensations, like pins and needles, or numbness that makes it feel like you're wearing thick socks or gloves when you're not. Some people describe burning or shooting pains, especially at night. This often starts in the toes and gradually moves up the feet, then eventually affects the hands. It's usually worse at night and can seriously impact your quality of life. The good news: if caught early and blood sugar is controlled, nerve damage can often be slowed or even partially reversed. But the longer it goes untreated, the more permanent the damage becomes. Sign number 8, dark patches of skin. This symptom surprises a lot of people because they don't associate skin changes with diabetes. It's called acanthosis nigricans, and it appears as dark velvety patches of skin, usually in body folds and creases. You might notice these patches in your armpits, on the back of your neck, in your groin area, or on your knuckles and elbows. The skin might feel thicker or softer than the surrounding area, and it doesn't wash off or lighten with scrubbing. This happens because of insulin resistance, the same mechanism that causes type 2 diabetes. In fact, if you notice these patches, it's a strong indicator that you're either pre-diabetic or diabetic, even if you have no other symptoms. Don't ignore unusual skin changes. They're often your body's early warning system. Sign number 9, frequent infections. Are you getting more yeast infections, urinary tract infections, or skin infections than usual? High blood sugar creates an environment where bacteria and fungi thrive. For women, recurrent vaginal yeast infections can be one of the first signs of diabetes. For both men and women, frequent UTIs, gum infections, or skin infections that keep coming back despite treatment should raise suspicion. High glucose levels also suppress your immune system, making it harder to fight off these infections once they start. If you find yourself on antibiotics frequently or dealing with infections that won't seem to clear up, it's worth checking your blood sugar levels. Sign number 10, irritability and mood changes. This is the symptom people least expect, but it's very real. Blood sugar fluctuations directly affect your brain function and mood. When your blood sugar is too high or drops too low, you might experience irritability, anxiety, difficulty concentrating, or even depression. You might snap at loved ones over small things, feel emotionally unstable, or struggle with brain fog that makes it hard to think clearly. Many people with undiagnosed diabetes report feeling like they not themselves but can't put their finger on why. They might think they're just stressed or overwhelmed. While those could certainly be factors, don't overlook the possibility that your blood sugar is playing a role in how you feel mentally and emotionally. So now you know the warning signs. But what should you actually do with this information? First, don't panic. Having some of these symptoms doesn't automatically mean you have diabetes. Many other conditions can cause similar signs. That's exactly why you need to see a doctor for proper testing. Second, don't wait. I can't stress this enough. The earlier diabetes is detected, the better your outcomes will be. If you're experiencing 2 or more of these symptoms, schedule an appointment with your healthcare provider this week, not next month, this week. Third, know your risk factors. You're at higher risk if you are overweight or obese, live a sedentary lifestyle, have a family history of diabetes, are over 45 years old, have high blood pressure or high cholesterol, had gestational diabetes during pregnancy, or have polycystic ovary syndrome. If multiple risk factors apply to you, be even more vigilant about these warning signs. The tests are simple. Your doctor can diagnose diabetes through a fasting blood glucose test, an A1C test that shows your average blood sugar over 3 months, or an oral glucose tolerance test. These are quick, relatively inexpensive, and can give you definitive answers. And here's when you need emergency care. If you're experiencing extreme thirst, very frequent urination, rapid weight loss, severe fatigue, nausea, vomiting, confusion, or fruity-smelling breath, get to an emergency room immediately. These could be signs of diabetic ketoacidosis, a life-threatening complication that requires urgent treatment. And remember, even if you're diagnosed with diabetes, it's not a death sentence. Millions of people live full, healthy lives while managing this condition. The key is catching it early and taking action. I know this video might have been a bit scary, but knowledge is power. By recognizing these early signs, you're taking control of your health. You're not ignoring symptoms and hoping they'll go away. You're being proactive, and that's exactly what you should be doing. If you found this information valuable, please share this video with your friends and family. You never know whose life you might impact. Someone you care about could be experiencing these symptoms right now and not realize what they mean. Let me know in the comments, were you surprised by any of these warning signs? Have you or someone you love dealt with diabetes? I read every comment and love hearing your stories. Before you go, make sure you're subscribed to this channel and hit that notification bell. We're constantly creating content to help you understand your health better and make informed decisions. And remember, your body is always communicating with you. Don't ignore what it's trying to say. Those seemingly small symptoms could be early warnings that give you the chance to prevent serious complications down the road. Take care of yourselves, be kind to your bodies, and I'll see you in the next video. Stay healthy, everyone.